Welcome to our In Focus discussion tonight. From a news perspective, the COVID-19 pandemic presents a challenge. The daily demand for actionable information often butts heads with the pace of science. One day, masks may be required, the next day they may not be. And because of this, our 7 p.m. news team aims to take a monthly look at where we are in the pandemic to try to cut through the daily onslaught and offer some perspective. So today, we look at the pandemic with the best information we have now, what it means, and what we can look ahead to. Kicking off our conversation live via Zoom is Brian Cowan, the Executive Director of the Weber Morgan Health Department, to talk about the numbers and vaccinations. Brian, thank you so much for being here with us tonight. Let's start with the vaccination numbers. Focusing on the good, the state's administered more than 2.7 million doses. What percentage of that is our total population and then our eligible population?
Right, Rosie. So the vaccine data information is published daily and available to the public on the Utah Department of Health's coronavirus dashboard. You can find that at coronavirus.utah.gov. And we're actually reporting 2,802,000 vaccines administered today. So a little bit higher than the 2.7. In that, it includes 1,352,000 people that are fully vaccinated, meaning they've received both a Pfizer, 2 doses of the Pfizer or the Moderna vaccine, or 1 dose of the Johnson & Johnson vaccine. And it includes another 1,573,000 people that have received at least 1 dose of vaccine in that count. Breaking that into a percentage of our population, that's 49% of Utah's total population that's received at least 1 dose. 42% of our population that is fully vaccinated. Sometimes you'll hear these percentages reported a little bit differently as a percentage of the eligible population. And what that means currently is everyone older than 12 years of age. So if we look at that percentage for the eligible population, it actually is a better number. 61% of people eligible to be vaccinated have been vaccinated, have received at least 1 dose. 52% fully vaccinated.
Yeah, when it comes to these numbers, there's so many different layers to them. So I appreciate you putting that in perspective for us. Brian, talk about the effectiveness of the vaccines. What are you seeing with the new case counts?
Case counts in the state have kind of been relatively consistent for about a 4 or 5 week period, with little bits of upticks or downticks. In the Weber Morgan Health District, we are averaging about 30 to 35 new positive cases a day, and it's been that way for about 5 weeks. We think part of that stability is a result of the vaccination efforts and their effectiveness. We're also hearing reports from the hospitals and the people that they're admitting because of the COVID illness, and we're seeing that somewhere over 90% of those people that are being admitted with COVID are unvaccinated people, and that I think also communicates a degree of effectiveness of the vaccinations.
Yeah, and that's very comforting. Brian, nationwide, we are not seeing a good rate of younger people getting vaccinated. Are you seeing that here in Utah as well?
Yeah, we are seeing that a similar trend in the state. If we look at the age groups over 50 years of age, the vaccine uptake has been very good. In some cases, the age groups of over 70, it's better than 90% of the population. But as we look at the younger demographics, we notice that uptake is a lot smaller and a lot slower in process. For example, the 19 to 29-year-olds are only at about 50% of that population having received 1 vaccination.
Brian, are there any other demographics that may not be getting vaccinated? And if so, what could be some of the contributing reasons for that?
Well, along with age, we do kind of monitor race and ethnicity, as well as socioeconomic status. And we are seeing that there is some hesitancy in those other groups as well. And that could be contributed to a lack of trust in the vaccine, just a fear of vaccinations themselves, or not liking to get the vaccine, or it's hard for them to get to a clinic for whatever reason. And the local health department says, as we look at these different demographics, we've tried to target our interventions to reach out to them and get to those populations. And we're doing that by pop-up clinics with religious groups, at work, pop-up clinics at workplaces, and at community events like the Ogden's Farmers Market to try and reach more people in our population.
Now, Brian, there has been an uptick in cases over the past few weeks as far as the percentage of positive cases, people over people and tests over tests has gone up. Why do you think that is?
Well, it's kind of fun to watch data and find the story that it tells us. And really to do that, it helps to understand the context of the data. We have a tendency to look at trends rather than daily numbers. So, we can see an average of population, and that kind of helps us see that when there's an uptick in the past 5 or 6 weeks, it's been a small uptick or a decline, a small decline. But one thing we are noticing with that slight uptick in percentage of positive tests over tests, a portion of that can be contributed to fewer people getting tested. And so our advice to everyone is, if you feel symptomatic or if you believe you've been exposed to coronavirus, continue to search out testing and get tested, just like we have done for the last 18 months.
Right, better safe than sorry. Brian, about 30 seconds left. What are you most concerned about at this stage of the COVID-19 pandemic?
Well, our efforts at the local health department are focused on getting people vaccinated. And that's our biggest concern. But we also want to remind everybody that the risk is still out there, and to practice the risk mitigating efforts that have been in place since the beginning of this pandemic. And that's the Council on Mask Use. Unvaccinated people, that guidance hasn't changed. For vaccinated people it has, but unvaccinated people, we continue to counsel mask use, physical distancing, and staying home if you feel sick, and go get tested.
Yeah, this pandemic has been such a marathon, especially for those in the health industry such as yourself. So thank you for all you do. Folks, you've been hearing from Brian Cowan, the Executive Director of the Weber Morgan Health Department, to talk about numbers and vaccinations. Thank you so much for joining us to provide this update. We appreciate your time, Brian.
Thank you.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on the state of the pandemic. We continue our discussion on the pandemic by shifting to the Delta mutation of COVID-19, which is a variant of concern making headway in Utah. Joining us next live in studio is Dr. Nels Elde, an evolutionary biologist and associate professor of human genetics at the University of Utah. And Dr. Elde, thank you so much for being here with us tonight. Let's begin with the Delta variant, which seems to be becoming the most prevalent form of COVID in Great Britain and India. So what do we know about it, and why is it seemingly more contagious and dangerous?
Thanks for having me back, Rosie. So yeah, the new Delta variant that's been in the news headlines, as you said, coming up to prevalence in the UK, in India. Honestly, that's about all we know about it, other than a handful of mutations that make it a little different from the other variants. What we haven't done is put together a link. Why is it that those changes that we see lead to more transmissibility? Why is it taking over? And that turns out to be a pretty complex question that, of course, a lot of scientists, a lot of virologists are interested in.
Yeah, I see COVID as the enemy, and I just feel like our enemy is getting smarter. So I look at it. Dr. Elde, how concerned should we be about the Delta variant?
Yeah, so definitely not time for panic. I think to be alert as we think about this. And just like you're saying, Rosie, it looks like it's smart from an evolutionary standpoint. What's happening here is a random process of mutations accumulating, but then perhaps in some cases selection acting. As the viruses are competing with each other, what are the ones that win out? And so this is something to keep an eye on. And as we've already been hearing about and thinking about, what can we do in getting vaccinated? Living that vaccinated life is really the safest way to go right now.
Right. It sounds like we shouldn't be any more panicked or concerned than we have been, but we also shouldn't get comfortable and not be concerned about these variants, because they are still posing a danger to our community. Now, how effective are our vaccines against these variants of COVID-19?
Yeah, so this is some really good news as we've been hearing. So as we've been tracking the mutational changes very quickly what we can do is take these variants and then test them against our vaccine. What does this mean for our immune responses? Are they still effective? And the answer so far is a pretty resounding yes. We see some really slight decreases in some cases of vaccine efficiency, but that's nothing of efficacy. That's nothing to really worry about at this stage. These vaccines have proven to be, I think, possibly the medical breakthrough of this generation, and it's really a gift to us, to our communities, our neighborhoods, greater communities, that we have these tools that we can use to combat the pandemic as it continues to go on.
Dr. Eldy, can you talk about fitness in the arms race between viruses and immune systems? Is that a better measure than, how do you say this word, virulence?
Virulence.
Yeah. Okay, what you said, or transmissibility.
Yeah, so this idea of fitness, this is kind of what I work on over at the university in evolutionary genetics. And this is kind of simply defined reproductive success of the virus as it passes, as it infects and then passes from human to human. And so I think it is actually a really useful framework here. It allows us to step back, get a little more perspective on what's going on with these viruses here. And what it brings in actually is a competition. So it's not just the Delta variant, right? We've already stepped through a number of variants, this almost alphabet soup of different mutations as they've come up. And so by thinking about the fitness of the viruses, we're able to kind of get that wider perspective and actually think about, as the viruses are changing, are there patterns here, reoccurring things that we see, and can we use this information to do better, to know what might be coming, what the next variant might look like, things like this, and also to have this perspective that, we're still in that SARS, this is all SARS-2, these are very highly related variants, just a handful of mutations, and so I think that's a really important perspective here too. SARS-2 version 1.0 was bad enough, and here we are kind of on version 2.0, version 3.0, and to remember that the same things that we've been doing for the last year plus are the same things that work today, and to sort of carry forward here, to really follow through as a community. I think that's the best thing we can do right now.
And we are living the pandemic in real time. Science is trying to catch up to it as it happens. Can you talk about the balance of evaluating the rise in concerns of variants with giving good information to the public?
Yeah, this is a really good point, Rosie. So, we are exceptionally good at cataloging the virus, for decoding the genome of it. And in fact, I can go to a database tonight and find 2 million sequences of SARS-2 that have been gathered over the last year from various patients and compare them. And in fact, there are scientists poring over this information, trying to figure out what are the useful signals here. But there is this gap or this disconnect, so we can catalog this very easily and track the movement of the virus, but there's this gap in understanding. What do these evolutionary changes, these genetic changes mean for how the virus might be transmitting more, how it might be more virulent, as we were discussing a second ago? And honestly, we don't know yet. This is the work ahead. It's going to take years to understand this. It's really important to unravel this, because this will help us do better in the pandemics of the future.
We admire and respect the work that you all do so much, because we know it's not easy. Dr. Eldy, what concerns you the most at this stage of the COVID-19 pandemic?
Yeah, so I'm a little concerned, as we've been talking about sort of the stalling of our vaccination programs in various corners, including some of our own localities. I think this is, it's time to step back and really think about what we can do for our neighbors, our families, each other, by taking this step and getting vaccinated. At the same time, I'm also concerned about how the conversation is going a little bit, how we're thinking about, so when we think about the origins, where did SARS-2 come from? There's this danger that we might be sort of, shooting the messenger, as the old saying goes, where we're kind of vilifying scientists even in some cases, and kind of suspicious about what scientists are doing. That's why I'm here tonight, actually. So scientists, we like to kind of hang out in the laboratory and do our work kind of quietly. I think this is a moment where we need to come forward and have these conversations together to try to understand what we're working against as a community, and to understand that this research, just as you're saying, Rosie, the breakthroughs of the vaccines, this is because of the research that's been done over decades. And so I'm concerned that we might lose that perspective, and so that's why I'm here tonight, to say, let's have that conversation together.
And you're right, we need to be respectful of you, our researchers, our scientists, our medical experts, because you were trying so hard to get information to people as quickly and as advanced as possible, but it's this takes time. So yes, thank you so much for joining us tonight. Folks, you've been hearing from Dr. Nels Eldy, an evolutionary biologist and associate professor of human genetics at the U of U. Doc, thank you so much for coming back to the show. It was a pleasure to get your insight and expertise.
Thank you, Rosie.
We'll be right back. Welcome to our third and final In Focus discussion tonight on the state of the pandemic. Now we turn to the mathematical modeling on the nature of the COVID-19 virus. What do the numbers say this pandemic could look like 10 years from now? Rounding out our conversation tonight live in studio is Dr. Fred Adler, professor of mathematics and biological sciences at the University of Utah. And Dr. Adler, thank you so much for joining us tonight. What factors did you take into account for your modeling?
So we were curious about the longer-term trajectory of this pandemic, and in particular something different than we heard about from Dr. Elde, which is how the immune system itself will respond as people become more familiar with this virus. And so we included three factors that are all known, though not fully quantified yet. One is whether or not who gets the most severe cases, and we know that children get less severe cases than adults in general. The second is whether or not people who've had the virus or the vaccine get less severe cases, and whether people who get infected by milder cases also get milder cases because they get a smaller dose. And so we put those things into a mathematical model to see what the consequences would be over the next decade.
That is fascinating. Now, the results were that a strong possible outcome would be that COVID could become the equivalent of a common cold. What was the likelihood of that outcome, and what were the other outcomes?
Mathematical models of this sort can't tell us the exact future. We can lay out a range of possible futures, and at this point we don't have enough information to say the exact likelihood of any of those particular futures. So the range runs from it becomes just another common cold to it becomes something that remains more severe than influenza. I'm optimistic that it's going to be closer to the first, but at this point I can't put a probability on that.
Now, can you talk about other factors that may affect the outcome that you didn't model for?
Yeah, we did not have information to model the new variants. So our model assumes that we're working with SARS-CoV 1.0, the original version. And we don't know whether these assumptions we're making about immunity and about severity in children, or even the way it's transmitted, will hold up for those variants. I think they will primarily, but the numbers may turn out to be different.
There's so much new information, and these variants are mutating and coming at us so quickly. How does vaccination play into the models? If more people are vaccinated, would the outcome be different?
Yeah, and vaccination is great. It's a way for us to short-circuit the whole process. So the assumption of this model, which we do see with other viruses, is that people who get infected now have partial immunity after they've recovered. But getting infected, as we know, is a major risk for your health. And why go through that if you can become immune just through the vaccine? So the vaccine is a great way to jumpstart this process. So even if we don't succeed in eradicating the virus, by having a large fraction of people immune to the virus or partially immune to the virus, when they get infections, they'll be much milder, and we hope then produce milder infections in those that they are exposed to and continue this process.
Dr. Adler, there is already a segment of the population that doesn't think the virus is a big deal. Is there a concern that those who are already vaccine hesitant would be even more resistant to the shot after hearing that COVID will become likely the cold?
I mean, I obviously hope they would not do that. I think the strongest argument is the vaccine is our friend in more than one way. It not only reduces the number of cases, but in the long run, by helping our immune systems, the best weapon we have against this virus, by helping our immune systems get trained, that we can make the cases that we do have to be milder cases. So I'd say that's sort of a spin-off benefit of the vaccine.
Now, if only we can get people to understand and accept that and realize the importance of that. Dr. Adler, given what you've studied, where do you think that we will be with the pandemic in the next 10 years?
Yeah, I'm always wary of making long-term predictions. I do not think this virus is going to go extinct. I think that this virus will become more mild due to immune responses, and my guess is it's going to be somewhere between common cold and influenza, but that is certainly a guess, and I would not want to, have policymakers believe that.
Dr. Adler, given everything that we know up to this point and what you've seen, what concerns you the most about where we are in the pandemic?
The same two things that I think everyone else is concerned about. Low vaccination rates, meaning that people are still getting sick and still ending up in the hospital. Those low vaccination rates mean that people are getting new variants, and these new variants may be able to evade our immune response. This is something we see every year with influenza. As new variants arise, people have to try to choose a vaccine that catches those. To this point, the amazing new technology we have for vaccines is good at catching the new variants, but at some point, variants will emerge that start to escape the vaccine and the immune control, and that means that this process that I'm optimistic about may not play out.
And I think we cannot drive that point home enough. Vaccinations are so important, especially in our younger population, who may be the key for us to just say goodbye to this pandemic once and for all. All right, thank you so much. You've been hearing from Dr. Fred Adler. He is a professor of mathematics as well as biological sciences at the University of Utah. Dr. Adler, thank you so much for making time for us and joining us on the show tonight.
Thank you.